Okay, so welcome everyone, including the two people in the seminar room too. And welcome so much to Sikhumbuzo Mabunda, who is a former registrar, now PhD student and public health medicine specialist, PhD student at the George Institute in Australia, who's going to be speaking to us today about some of his PhD research related to human resource planning and the question of service bursaries. So when students get a bursary from the provincial government and have to work it back, does it really work? So that's what we're looking forward to hearing about. And Sikhumbuzo told me that the one thing he's learned is that we do human resource planning very poorly, and we should really spend a lot more time thinking it through. So we're very pleased you're here, and so glad to see you back here. And even though things have changed a lot, we're really looking forward to this talk. Thanks. Over to you.
Thank you, Prof. London, for the kind introduction. And good day, colleagues present and online. I'm hoping that I am visible enough and trusting the technology. So Sikhumbuzo is my name, and as Prof. London has introduced, my topics really looking at the human resource for health gaps and challenges that we have. Oh, there is a concern that they're not able to see the presenter. I guess, unless if I should be sitting somewhere else.
Apologies there, the camera has stopped working.
So, you can continue. I think we can get another camera on.
Yeah, I will.
Get another camera.
But please continue.
Okay.
Yeah. Sorry about that.
Okay, apologies. The camera is taking a break. We might have a camera during the course of the presentation. So I think it's safe to start off by acknowledging Rural Support Network, a student-based organization here at UCG and other institutions as well, that has shaped my career trajectory, and acknowledging the past and present leaders, also acknowledging my supervisors in Australia who might possibly be listening in, Professor Rowena Joshi, Dr. Blake Angel, and Emeritus Professor Andra Dubach. And then also from the various colleagues who have supported me while I'm in Australia, to actually collect and successfully execute my study from afar. So I'll just go through firstly the introduction and methods, findings, and then some of the publications that we have on this work. I think it's safe to say, for those who will be present for tomorrow's presentation, rest assured that tomorrow's is completely different from this one, in that this one will be focusing on 4 different countries at a high level, and then tomorrow's we'll be focusing on just South Africa and the various provinces. At some stage, believe it or not, I was the tallest of 4 siblings. And growing up in a rural place in Mpumalanga, if you can see and eyesight is good, you might see that there's a sugarcane plantation behind me on a farm. And we grew up wondering, you know, why it is that our family needed to go far for healthcare, especially specialized healthcare. Because at the time we never understood, you know, that they were specialized and all that. And as far as Pretoria, which is over 500 kilometers away. And as such, then a young man called me was driven to do medicine and move out of that and hopefully change the situation. That is what I thought I would do at the stage. Safe to say, I'm now no longer the tallest of all these ones. They look down on me. And human resource for health strategies, you know, that have been used to increase health workforce capacity can mostly be classified into 4: financial incentives, educational strategies, personal and professional support, and regulatory strategies. With all these strategies, we basically want to find out if they increase and they are actually better at doing nothing. 2, are the policies actually sustainable, all in all? Rural Support Network has set one of the longest student-based interventions, you know, and the objective of Rural Support Network was really to say, let us expose health sciences students early to a rural environment. Let's advocate for increasing intake of rural origin health sciences students within the health science faculties of the medical schools in the country. And this also impart career guidance sessions and recruit rural origin high scholars to come to a university as prestigious as UCT or any other university in the country, and them knowing about, you know, the various options they can have within the health sector. So as a student, I led Rural Support Network for about 4 years of my life at the local level and national level. So that is why it's so important in my life. And at that stage, I still thought I would be a surgeon for some other reason. And you know, it's only until later on in life that I realized that I was a dreamer. So what are return of service schemes? Return of service schemes are schemes where future skilled health professionals are granted funding for studying a health profession of their choice in return for a service. So they're contracted for often a year, you know, in return of service. Other Southern African countries generally send students to South Africa and abroad. And South Africa will be sending students to Cuba, Russia, in case of other provinces, you know, but mostly studying within the country. The South African-Cuba agreement has been in place since 1998 and is for 8 of the 9 provinces. The primary objective of these schemes is to increase the pool of skilled health professionals for a defined period. The secondary objective says, if we give you funding for 6 years, let us hope you will stay even beyond that 6 years. If all worked well, it would be a smooth linear process. Put in funding, identify the beneficiary, you will get a health professional who's going to service your area of need. That is how it would ideally work, or should ideally. The challenge is that we do not know much about these, the origin of these schemes. We just know of their existence. And we don't know much about how much it has benefited the system. The processes of implementation at the various stages are not well understood either. And it's not just a South African or Southern African issues globally. The policies have not been systematically evaluated. What we know, though, in science, we'll say anecdotally, but sometimes anecdotal is what we actually have experienced in practice, is that neither the primary nor secondary objectives have actually been met, mostly due to poor monitoring. What we also know is that African governments do not have enough money for future salaries and thus end up releasing beneficiaries from contracts. I mean, you might not believe it, but a country like Eswatini currently has about 30 medical graduates who studied overseas because they did not have a medical school, unemployed for the past 2 years. But I can tell you now, the health facilities need health professionals across the board, only because they do not have funding for actually absorbing them within the system. This then paradoxically ends up being the poor countries training for high income countries. So they would have spent money on the funding, and in return, well, they did not have any job for them. Health professionals end up being released and they go to high income countries. I live with some of them in Australia, by the way. So later on, after realizing that I could not be a surgeon, I ended up being a public health specialist and started asking questions around this, because I am a beneficiary as well of one of these schemes from the Mpumalanga province in South Africa. Now, the questions, as I asked earlier, are these policies better than doing nothing? And are they sustainable? So the reality is that this is a very complex maze. You ideally should be identifying, linking up with the burden of disease that you have in society and projecting it and forecasting it over time. Saying this is what you have in your health system. Unfortunately, as an example, we as epidemiologists and public health medicine specialists are completely not involved in this process of planning. It's merely a human resource planning process. And then there is the process then of availing the funds themselves and also linking it up with possibly the future salary needs of these people that you are going to fund. But at the same time, you need to identify the possible areas of attrition as well, which are right at the bottom. So you realize that a human being could have come in a person who is poor and needy at that time. They get into a health sciences faculty, they get washed up and exposed to a different type of life. Our medical schools, by and large, are in urban areas, except now when we've got Limpopo and Sisulu that are in rural environment, but one could argue. So how do you then ensure that you mitigate against all that to ensure that these people go and service the system? But put all the systems in place for monitoring and supporting of these individuals while studying and when they are already working, to ensure that they do not actually become a loss to the system, like you do with any other investment. An investment is nurtured, an investment is taken care of, an investment is well looked after altogether to ensure that you continuously ask yourself, is it still worth pouring money in this particular investment or venture rather. So with this study being conducted in 4 countries, initially we included Namibia, but then the processes were slow. We looked at Eswatini, where there's no medical school, with Lesotho, South Africa, all the 9 provinces, and then where there are 10. Botswana, where there is 1 medical school. So mostly, obviously, these countries rely on students being taken abroad. And we focused on having a record review and a literature review. Record review would say, let's look at all the documents that are used for these policies. Let's go to our archives. We understand that South Africa was a different country in 1980 or whatever year, or in 1960 for that matter. But an institution of government, regardless of who is in power, should have all the resources on any document that you need as to why actually money is spent on it. Because it takes processes in government, for a policy to actually be passed. It would have come from some acts or some regulation, and then there would be minutes of some kind, and then there would be a signed off document that allows for the release of monies. And then you're saying at the same time, we hope that the scholarly material as well, in addition to the grade material of the original of the documents and the various versions of the policies, the reviewer and all that, there will be scholarly material as well that people would have written about these policies, when they started, when they stemmed from, or even advertisements to some degree as well, And then also do interviews with the policymakers on what their impressions are on how these policies work, where they stem from, and what they think, how they think they are working. To actually close it off, then we do a retrospective cohort study of those who were funded between 2000 and 2010, because we're saying there's a long enough period to assess if individuals would have served their obligation, and if they've served beyond that obligatory period as well. And for all these, we had to get the necessary ethics approvals and also access approvals, since in the case of South Africa, for instance, where you go to each and every one of the provinces. There are a number of reasons why governments would give funding for any student, to go and study and further their education. Part of it is because they already existed. There's a continuity from the previous government, so they just, continuing the process of funding. Another one of commonly is social responsiveness. As government, someone is needy or disadvantaged, they cannot afford to study, therefore we give them funding to go and further their studies. Of interest to us is if this is a solution, or a sustainable solution for that matter, for health workforce challenges. And that is recruitment and retention of these health workers that you actually go to fund. Other ones would be responding to legislative mandates, including the Constitution in the case of South Africa, which stipulate that you need to upskill your current crop of employees and other acts and regulations that come with that. You also reward merit, those who have good grades in matric, and say, as government, we want to recognize that you're doing well, we therefore give you funding. And probably you will be a good health professional in the future and a good investment. And then political reasons. The Cuban-South African agreement being one of them, for instance, where South Africa regularizes support of Cuba through that process. We give you so much money, and you're going to have students that we send to you studying there. So that is a regularized way of money being released out of government coffers and not having organizations taking government to court. Then you've got Russia as well, part of BRICS. You also have similar agreements between Russia and Mpumalanga province. We've signed so many other agreements that we have, and then for this one, that actually focuses on students being funded to go to Russia. And these schemes are run, there are similarities between the four countries, but all of them have got their own unique way of running them and the type of funding that they offer as well. So you have in Botswana, the Ministry of Education completely running the scheme, no involvement of the Ministry of Health, and there's no interaction even. Their mandate, as a matter of fact, within the Ministry of Education, there's a section of Ministry of Tertiary Education, a complete whole building, bigger than the formal building probably, that focuses merely on funding tertiary students. And that obviously one would expect, because there's the expectation within their policy that they're going to return in service, that there will be some interaction with the departments, including the Ministry of Health, but there isn't that. In Lesotho, there's an agency, National Manpower Development Secretariat. It's more like an SOE sort of state-owned enterprise. So that agency is responsible for all funding, including individual funding. If you are to apply for a scholarship from the Wellcome Trust or whichever organization as a Lesotho national, and you get that scholarship and you go and study wherever you study, the government expects of you the same way as if the money came and was derived from government coffers. And that is an act in Lesotho. I mean, their expectation is that you study, and then in return for service is a degree times 2. So if you study for 5 years, you return in the country for 10 years. Mm-hmm. If you go into the country and serve, you will repay, you only need to repay 50% of the funding that you received. If that's in the public sector. If you go to the private sector, on the other hand, you repay 75%. If you do not return altogether, you repay 100%. Whereas if you do the mathematics, you realize that those who return, in a way, I should change. and then you've got Eswatini. You've got 2 ministries. The Ministry of Labor, that focuses on every single one who is a national. The Ministry of Public Services focuses on those who are employed already in the public service, for them to be upskilled. And they will be functioning in mostly similar ways, but then those funded by the Ministry of Labor mostly would say return on a year for year of service, plus 1 year in addition to that, and repayment of the loan 50% if in the country and 100% if outside the country. And it doesn't matter whether in public or private sector with them. And then whereas with the public services, the difference is that when you are working, there's still an expectation that you return to the country and the same way as the 50% and 100%. But then the expectation is also that, or rather when you go in and you study up to 3 years, your salary will start at 100%. It reduces until it gets to 25%. That you get while you're out there. They pay for your full fees and all that. So that's just going to be a living allowance in a way. And then beyond that, it's going to be at that 25% maximum ceiling or floor. And then you return to the country, you retain the salary or get a promotion if there is a position. Again, with this ministry, it's, in Lesotho and Eswatini, there's no interaction with the Ministry of Health altogether. In South Africa, most of the provinces run it through the Department of Health, except for the Free State, where it's completely run by the Office of the Premier, no interaction with the Ministry of Health. Mpumalanga, the Cuban program is run by the Ministry of Health, the Department of Health. And then all others by the Department of Education since 2014. And then the Department of Education also then funds the South African-Russia agreement. In Northwest, the Cuban agreement, completely the Department of Health, all others, Office of the Premier. Northern Cape recently moved all funding to the Department of Education. These ones, there is some interaction, except for the Free State, where there's no interaction altogether between the ministries, health, and also the Premier. Western Cape, the same Minister of Health, but then they do not have a Cuban scholarship or program. And all of them is a year-for-year return of service. The difference is how much they put in, where the Western Cape has kept it and would say, we give you 30,000 rands, regardless of how much your fees cost. Generally, they are structured around the fees of the University of Stellenbosch, which accommodates, actually cater for all the fees and the needs if it's the University of Stellenbosch. But if it's a case of UCT or VETS where it's a bit higher, then the student would need to pay up the difference. Whereas all the other provinces actually cover the full cost of the fees, including allowances and some books as well. So of interest then is that in our findings, we find that there is no single country or province that has founding policy documents of these policies. Lesotho has a Loan Bursary Act, 1978, but it's not known if that even is the origin. But anecdotally, there's evidence that actually there is something that happened before 1978 even. So the act was a response to what was already happening at the time. Botswana used guidelines for grant loan scheme that was founded in 1995, but they had been funding students way beyond 1995, or before 1995. South Africa, some of the provinces do not even have signed off policy documents that are current. They've not have, actually, they've never had any that you can see. And the belief is that they would have been there at some stage in life, but just that no one knows where they are. And most of the time, the answer you get is that I was not here at the time. The earliest policy document that we could find of any of the provinces is KwaZulu-Natal, that has a 2010 one, and makes a reference to a 2003 policy document that we couldn't find. Mpumalanga province has beneficiaries as far back as 1989, but they cannot find the policy document for funding of those students from whenever around 1989, as a matter of fact, you know. And Western Cape, of surprise, is that, well, surprise to some of us who have worked for the Western Cape Department of Health, is that they could not retrieve information for before the year 2012. Policymakers say the policies have not been evaluated. There are high defaulter rates. There's a lack of reality determination of service needs. And it's just a meeting that comes in and sits and determines, you know, how many vacant posts there are, and if they are struggling to advertise, how much money there is in the coffers, and see how they distribute it between the districts. And as such, the bias is towards medical students who are mostly placed and offered these bursaries, whereas then all the other health professions are ignored. Poor planning and forecasting, there is poor monitoring, poor coordination between the departments, and obviously at some stage, whichever department is involved, the Ministry or Department of Health would have to be involved in placing them in service and paying of their salaries. And that is lacking, unfortunately. And then, as you said, there's poor skills mix, and they're saying it's not sustainable across the board, and the schemes are costly as well. So as an example, a participant in Botswana says, we have had students years back, especially those who were placed in Ireland who did not come back. I think most of them actually are still there. So they're aware of this, you know. We've got these defaulters, they're out there somewhere in the world. We've trained for a high income country. So the beneficiary databases themselves then, most of them use an Excel spreadsheet. Unfortunately, so Muzamil will tell you, an Excel spreadsheet will allow a single view at a time, one dimension. Whoever is on the computer and looking at it at that time is the one who can work on it. You would not then be able to change the information for someone else. Even if you create it as a macros or whatever it is, it's still going to be an Excel spreadsheet on a one dimension. And the data is largely incomplete and inaccurate. Botswana has an access system built database. It took more than 2 years to retrieve the information. they were trying to find it through that time. They just couldn't. They did get the information. It was limited because we needed longitudinal information on who they funded in terms of their sex, gender, their age at the time, their marital status, the place of residence at the time when they funded them, the university that they went to, and even race as well, and where they returned to after completion of their studies, how long they served in each of the facilities beyond that completion of their studies. All they could give us was the information on the names. Obviously, we did not have they did not give us the name, but they have the information on the names. They have the information on how old they were when they offered the funding, the period when the qualification was commenced, the name of the qualification and country where they studied, but there was no information on the duration of the funding or even how much they spent on any one individual. And nothing on the return of service, if they return for service at any stage and how long they even return for. Obviously, that would not be there if they did not even know if they return for service. Similar in Lesotho as well, where they use an Excel spreadsheet. Took more than 2 years to retrieve the information as well. Also limited information. Eswatini used a spreadsheet, but then what they've done is because of the high defaulter rate, they've had an agency or a consulting company to track these defaulters. So this agency is the one that the government relies on. They sent me to these individuals to go and get the information on the funded beneficiaries. But even then, the information is inaccurate as well. Even some information is so inaccurate that one knows the University of Cape Town. You can look across the prospectus and it says this qualification, and you know it doesn't exist at the University of Cape Town and many other universities, you know. So it's such information that you realize the data integrity is questionable throughout. Now, in South Africa, on the other hand, is not that different, you know, from the other countries. No province has longitudinal data that you can get that will tell you this one person you funded, this 1 year, this is what happened, and until the end of even the tenure or where they are now. That is not possible. Logically, you would think that it's linked to the personal administration system, which is PESAL, from which salaries in the public sector are paid. But unfortunately, it's not even linked then directly. It's only when a person resigns that they know that this person was actually funded and they cannot be terminated. But not for the purposes of actually seeing this person throughout the period as to where they are and so on. They have to manually, you have to give them the name of a person for them to search for an individual's whereabouts. And unfortunately, PESAL also, as you might not know, has a time period when the information is not on the system. You go to National Treasury to retrieve it in archives of National Treasury beyond 10 years or so. And that is also a mission as well, you know. So it's definitely not useful in that sense. Eastern Cape took 3 years to retrieve beneficiary list of those who studied in Cuba, but they can't find information for any other students, even though they found many others in the country. Actually, them and KZN are the biggest funders of these schemes. Limpopo is the only province with a dedicated list of defaulters. You might not know, a few years back, Limpopo even released the names. That's before the Poppy Act, you know. They released the names of individuals on one of the Sunday newspapers of defaulters. Please help find these people that defaulted. So there is a spreadsheet of that nature in Limpopo, but elsewhere you don't find that information on people who have defaulted. But even then, you do not have the linkage between, you know, the individual who has actually been returned in the province and how long they have returned for, how much funding has been allocated or apportioned to any one individual. And I mean, on average, the provinces still took 2 to 6 months, because you'd expect that a government that is functioning would give you that information instantly. So a question that one then asks, are these return of service schemes similar to any other investment that you have? Because if you have an investment, they will say, those who know, high risk, high return, and at the same time, you make sure that you look after your investment and water it as much as possible, if needs be. So how much investment or protection are we putting into these investments, and a value do we put into this very investment that we know that is going to be worthwhile for us? And we are not questioning by any means the utility of ROS and the role that ROS schemes play in uplifting those who are needy and social responsiveness of government. I mean, it could well be taken by the NSFAS or any, in the case of South Africa, or social development for that matter. We don't have a problem with that. What we're questioning is then, are they actually a resource that we can rely on as a retention strategy for health workers? Now, that is what we're battling with. So far, we've had 3 publications, one a commentary on most of what I've raised today, and then also the full protocol of what we envisage to do, and then recently experiences of the policymakers on South Africa's experiences of implementation of these schemes. This, I mean, it's ongoing work. We are still working on finalizing actually publications on the historical evolution. We've gone through libraries, national libraries of these countries to find this information. And we've gone through many books, and electronic and manually, to actually find this information. Unfortunately, we have hit a brick wall. The earliest for South Africa that we can find is 1965, and then some mention in 1928, when there was something discussed in government somewhere about the funding for Black education and so on. But that is all there is to it, you know. So we are still wanting to learn more, and there's a lot more to learn. We always, it's supposed to be collaborations. We always welcome collaborations as the George Institute and the University of New South Wales, health systems, and also global health research. These are people that always inspire me and make sure that they support me when all the ships are down as well. But because I constantly question through them, you know, because they always want to know if I have found the answers and when will I find the answers to these 2 questions. If these policies are better than doing nothing, and if these policies are actually sustainable, and I still can't answer you if you don't ask me those ones. But otherwise, any feedback is welcome. Thank you.
Thanks so much, Sikhumbuzo. That was a great presentation, and a sobering lesson about what you could tell your family about research, self-research. I can't actually see people online, so I don't know if there are questions. Let's exit. Okay, let's do it like that. And here we go. Okay. Well, while I'm trying to get a view on that, are there any questions from the audience?
I had a question around, the countries that have 0 medical schools. So is it that 100% of the health professionals in those countries are people who are trained outside the borders of that country? But some of them are privately funded and some of them will have received funding from the government. That tends to happen for the surgery and specifically.
Oh, yes, thank you. I think so. Firstly, well, we say medical school, mostly mean a medical school where they have a program for training medical students, or sometimes dentistry as well, dentists. All the countries do have programs where they train, for instance, nurses, radiographers, and other allied health professionals. Lesotho, for instance, recently introduced a program on training dental therapists. So there are some health professions trained within those countries. But then those that they do not have is the medical students. And yes, some of them would have been funded privately to go outside the country and then return. In the same way that South Africa now has students going across to China, even privately funding themselves, and are now even exploring going to Mauritius. So there is that.
Very interesting. Itu?
Thanks for the presentation. I think my question is one for South Africa, well, Limpopo in general, but also could apply to South Africa. The impact of NSFAS taking on more funding of students, whether health sciences and other ones, has that perhaps in your discussion resulted in a reduction in the number of bursaries that departments of health or treasury or premiums offices are offering? Because I think that's one thing that on the ground I'm sensing that there are some departments that have pulled back on providing the large amounts of bursaries that they need to give because now NSFAS is there. And then the second is the reasons behind the lack of records. Is there a specific reason? Is it based on perhaps, if the Department of Health is running the scheme like Limpopo, you will know who are the defaulters, whereas Department of Labor or previous office maybe does not really, have it stuck in the row. Are there specific reasons why there would be this high rates of lack of follow-up, if I can call it?
Yeah.
When you reply, can you just repeat the question? Because I'm not sure it was audible to
the... Yes. There are two questions that you asked. So the one is with the revolution, a paraphrase of Fees Must Fall in 2015, where you had NSFAS being given the responsibility of funding students who would not ordinarily even be funded by a government. Has that changed the outlay of the schemes and even how they actually work out in practice? And then two, you asked if the government, like Limpopo, for instance, which has the list of defaulters, the reason why the others do not have it because they are outside of the Department of Health, or because they might not have a vested interest in actually the end product itself, but rather having a resultant of actually giving someone funding. Is that the question? Or that was the question? Okay. So with the first one, the provinces have generally changed the way they fund students by and large after the Fees Must Fall era. So initially, most of the provinces were just funding those who they said were needy and below a certain level of family income. But over the years, the provinces are now including the so-called missing middle as well to then fund. For provinces like Limpopo and many of the other provinces now following, unfortunately, because they've had many of these students funded, and after 2017-18, when the biggest cohort of students who started in Cuba started returning, they couldn't absorb many of these students. They then released a number of the beneficiaries actually of their obligation. So there will be letters that they sent to a particular beneficiary after community service and say, because we do not have the capacity to absorb you, we now release you of the system and your contractual obligation. You can look for a job elsewhere. Secondly, linked to that then there are the non-bursary beneficiaries that we should not forget about, who are South African, who somehow found means to get through medical school, often through their families having to get a study loan. When they get into the system, over the years, more and more of them cannot find a job beyond after community service. They're struggling to find a job because the priority of the provinces is them placing the bursary beneficiaries. So, which is part of the planning processes where you would need to have synchronized all these processes. Now, so the ones who were so-called non-privileged were given a bursary, got a right to medical school. The ones who were so-called privileged struggled through medical school to pay their studies. Now they can't find a job, and then interest from the banks are accumulating. Unfortunately, they still need to pay that, and they can't find a job either. So those are the challenges that you're having, unfortunately. And yes, some of the provinces do not offer new bursaries at the moment, like Limpopo, for instance, does not offer new bursaries at the moment. So that is a challenge that you are experiencing. Then the last question there, no, it's not related to whether it's within the Ministry of Health or not. So it's an organization not having clear institutional memory mechanisms and archiving altogether. How do you ensure that regardless of who is there in the organization, there is continuity and systems are functional as a system and not based on an individual who is there at the time? That is the weakness that we have within our sector, unfortunately.
I think I'm going to take a question from Virginia. You have a hand up on this very psychedelic screens that we now have here. Virginia, you want to ask a question?
Thanks so much, and thanks so much for fantastic presentation, Sikhumbuzo. I want to, I'm aghast that people aren't tracking who they gave bursaries to, and therefore who they are obliged to be paying back in terms of service time. And it sounds to me like that this could be, the provinces and the countries could be accused by their treasury ministries of fruitful, of wasteful expenditure. So I want to know whether the Auditor General, and we get unqualified Auditor General reports, particularly in the Western Cape, of, we've got a clean audit. What does the Auditor General, what do they do about that? And then my second question is about the Cuban returnees. Is there a difference in their employment levels compared to South Africans? And perhaps you've got some data on that. Thanks.
Okay. Thanks, Virginia. I think that was clear to everyone. So, unfortunately, provinces like the Western Cape was one of the questions that we would ask the policy implementers was if there've ever been audit findings against them on this particular issue, given the fact that administratively things were not in place. Eastern Cape and KwaZulu-Natal were clear that there were negative audit findings against them, and they tried to address them, but not necessarily successful. The Western Cape, was unfortunately the audit process is a sampling process. All we could say, or we can say, is that probably they've been lucky. They've not been sampled at that level. I'm not sure why, but obviously those documents seem not to have been sampled because they've been getting clean audits across the board.
Okay, so Muzamil, you have a question?
Thanks, Sikhumbuzo. I think excellent presentation and fascinating insights into a real challenge actually that we tried to fix, but now starting to follow through with in terms of the evaluation. My question though is I mean, you started your presentation saying that there was a mismatch with regards to capacity and the need. So there was a reduction, or there was like lack of capacity in your rural areas, in certain sort of pockets of the country and in other countries as well. But what it seems now to happen, and I'm keen to hear your thoughts about this, is that we have shifted that balance where we've now created the capacity, but we don't have the resources to employ those individuals. And my question, my question in terms of your thoughts is, do you think we need to now shift and bring in that funding towards actually funding posts for the people that we've sent, as opposed to funding more bursaries? That makes sense.
Okay. Now, I'm trying to ask that question, and that is the philosophical question then that you were asking. And the reality that I will tell you in short is that you need to continue giving bursaries. The challenge that we're having is a planning challenge, where we know the health sector needs health workers, even though we've got so many unemployed currently. But the challenge is that we do not have the ability and capacity to plan properly as to where we need them and how to place them. And that is a historical issue where you fail to actually forecast on where to put them over time and have wasted resources and funding in funding many other programs that are not necessarily bursaries by them. They are not necessary. Or if it could well be bursaries, but funding it in the wrong place or funding the wrong candidate. Now, the issue of identification of posts is definitely important, but it's just part of the solutions. So you would need to work on it as a system holistically and say, how do we work on our health workforce challenges and how do we actually resolve that problem? It could well take you to go to rural allowance and review that, and not necessarily just bursaries. It could well take you to look at commuted overtime and say, how do you then restructure commuted overtime from it being a dependency issue of 53% of a person's salary. So it's not a simple issue of removing bursaries and then that's a solution to you actually having more posts. You'll be creating other challenges.
Thanks, Sikhumbuzo. If you needed a clearer explanation of a systems approach to the health system, that was an excellent kind of response to that question. I can't see any more comments in this terribly psychedelic view. So I'm going to think we probably need to round off and thank Sikhumbuzo for a really fantastic presentation, really interesting discussion. I've got some questions, but I'll ask you over lunch. Thanks for the questions in the room and for Virginia's question. And I see that Vivian Essel is on the line.
Oh, yes.
Anyway, you should probably link up with Vivian. So all our friends are coming to say hello to Sikhumbuzo. Thank you for joining, Vivian. And Sikhumbuzo will actually be speaking in the Health Intelligence Directorate tomorrow at 11, right? After 11, I'm not sure exactly when. And talking in more detail about the South African program. If anyone wants to join, you can just contact me. But thanks so much for coming. It's fantastic having you back and a great talk. Thanks. Okay, go well, everybody. Clappity clap. You ever seen something like this?
Yeah, no, it's
Okay, I'm going to leave.
Did you not click something back there?
This was looping, obviously. Yeah. Okay, well.
Thank you.
Okay.
I saw that.